Let's talk about the precursors of wellness and physical therapy in the United States. Though most of the 1800s, physicians classified diseases by symptoms, like for example, we have pain, fever, stool, headaches, and believed that an imbalance of humors caused the disease. As in the Greek and Roman eras, it was often thought that illness was the curse of God or the devil or due to fate. While herbal medicines were used, dosage was imprecise, and the general attitude was, if one doesn't work, another will. In addition to a lack of knowledge about pharmacologic toxicity, treatments such as dehydration, purging, and vomiting, and draining blood, or what we call bloodletting using leeches, were standard procedures. So, moreover, surgeons wore street clothes and wiped instruments clean before moving on to the next surgery. Because nearly 20% of the surgeries were during this period, though, were amputations, it is not surprising that nearly one half of the amputees died from infection. Despite the comparatively primitive state of medical practice in colonial America, advances in chemistry, laboratory equipment and techniques, bacteriology, and the use of previously discovered concepts during the 19th century in Europe gradually revolutionized medicine. So, for example, although Robert Hooke invented the microscope in 1665 and first proposed the theory of cellular life, it was Anton van Leeuwenhoek who first described bacteria a few years later. So, in 1870s, the germ theory was proven. In 1847, the American Medical Association, or AMA, was established. In the 1870s, Harvard and other medical schools eliminated the apprenticeship system, raised admission standards, required written exams and passing grades on those written exams, introduced a 3-year curriculum, and established departments in the basic and clinical sciences. In 1885, most other U.S. medical schools included a 2-year curriculum, with the second year being a clinical experience at the hospital rather than an apprenticeship with a private physician. During the late 19th century, Sigmund Freud, an Australian neurologist and founder of psychoanalysis, investigated what was then known as hysteria, or what we call extreme fear and emotional excess, and is now termed conversion syndrome. His studies demonstrated that some patients have symptoms including paralysis, blindness, and deafness without an organic disorder. The popularization of wellness and the enhanced understanding of psychological disorders contributed to the growth of the biopsychosocial model of medicine and health. By the early 1900s, which is already the first half of the 20th century and the birth of the physical therapy profession, medical school had an established 4-year curriculum of study, series of examinations, and hospital residency program before a student could become certified as physician. So the profession of physical therapy was born in the early 1900s, and its evolution mirrored the technological advances and needs of the medical profession. Precursors to present-day physical therapists were reconstruction aides who helped to alleviate the suffering of soldiers from World War I, II, and the Korean War, as well as those stricken with polio. The profession continued to enhance their education as well as credentials and skills. As the responsibilities increased, they became known as physiotherapists. In 1947, the WHO defined health as not merely the absence of disease, but the complete or a state of complete mental, social, and physical well-being. By the 1950s, physiotherapists were known as physical therapists and were eligible to receive insurance premiums. So, to meet the ever-increasing demands in the clinical setting, the first graduate entry-level physical therapy program was initiated in 1960. Despite the move to a graduate-level education, entry-level physical therapy programs continue to focus on restorative care, and the biomedical model. In contrast, the medical community began to discuss the merits of preventive care and wellness. So Halbert Dunn, a medical doctor with doctorate of philosophy, is regarded as the father of wellness movement. So Dr. Dunn introduced the concept of health or high level wellness in a series of 13 lectures he gave at the Unitarian Church in Arlington County, Virginia, in the late 1950s. So Dr. Dunn proposed that because environments differ, wellness is unique to each individual. Dunn also identified the 5 domains of wellness. First, we have the individual, including the basic human needs, growth, aging, and the inner and outer worlds. Second is family. Third is community. Fourth is society. And of course, the fifth one is environment. The physical therapy profession continued to expand during the 1960s. This expansion was fueled by the inclusion of physical therapists in the Medicare Health Insurance Program and Health Professions Education Act by President Kennedy's administration. Although those in the medical professions, including physical therapy, were entrenched in the biomedical model, the biopsychosocial model was refurbished by George Angel, a psychiatrist. The biopsychosocial model, as opposed by Angel, declared that physical, mental, and social factors all play significant roles in human functioning in the context of disease or illness. So this is a significant strength of the biopsychosocial model because it adheres to the WHO's triad of health. So next we will be differentiating biomedical model from biopsychosocial model.